Grant Sudgeon's Chief Executive of Waverley Care, a charity set up to support those with HIV. He's with me now alongside Iain, who was diagnosed 12 years ago. Grant and Iain, good morning to you both.
Good morning.
Good morning.
Good morning. Grant, what is the picture like now with HIV in Scotland today? How many people are living with it?
We have approximately 6,415 people living with HIV in Scotland and another 500 people living undiagnosed with HIV. HIV nowadays is a manageable long-term condition and people can live long, healthy lives, but it's often the stigma that remains around HIV that makes it such a life-altering condition.
And as you say, you know, the way that people can live their lives now is quite different to 35 years ago.
Yes, we have really effective treatments here in Scotland for HIV, so people can, start treatment almost immediately after a diagnosis, become undetectable, which means their own health is in great shape and they can't pass it on to any sexual partners.
Iain, you were diagnosed 12 years ago. Tell us a bit about your story.
Yeah, well, it was obviously quite a difficult time in my life then. I'd been extremely unwell. I had a life-threatening infection. I was in hospital and they just couldn't really get to the bottom of it at all. And eventually they carried out an HIV test and it came back positive. It wasn't very well handled. There wasn't really any support available then, so you were really kind of just left hanging with an HIV diagnosis. So it was really quite a frightening experience then. You felt very isolated, you felt very ill-informed, you felt scared, and you felt really alone. I mean, it was really quite a dark time in my life then. So I had a lot of mental health issues arising from that. And it was a number of years before I eventually had the opportunity to meet other people living with HIV and share experiences. And that's really helped me a lot through the process of living with HIV.
And people would like to know, I'm sure, what's day-to-day life like for you? Is it remarkably different,
No, in terms of the virus, the illness itself, it's fine. I take one tablet a day, and that's it. I have very few side effects with the medication. Medication now has changed dramatically, so it's much easier. When I started medication 12 years ago, it was a lot more difficult to deal with. But my experience of living with HIV is really more to do with the stigma surrounding it. And that's the external stigma really caused by the attitudes of other people towards me as someone living with HIV. So, and that's really based on outdated information and myths going back to the 80s and 90s. But that also affects you with internal stigma because it causes a lot of feelings of self-loathing and guilt and unworthiness and things like that. So, it's really how you navigate that on a day-to-day basis. So now I've worked through that now over the years. Instead of that, instead of having that internal stigma, I feel much more proud of the fact that I've taken control of my HIV. I've taken responsibility for it. I know my status. I'm in treatment. I can't pass it on to anyone else. So I think people living with HIV who know their status and are on treatment and undetectable should feel really proud of that, and they should really be applauded for it rather than being, vilified and ostracized and having to deal with all this external stigma. I'm quite proud of the journey that I've been on, and I would encourage other people living with HIV to have that attitude as well.
And Grant, Iain talks about the stigma and thinking it's based on outdated attitudes. What can be done to change these attitudes? They're still hanging around now.
They are, really sadly. I mean, there was a poll recently that showed that most people in the UK wouldn't be comfortable having a sexual relationship with someone living with HIV. We've seen an HIV stigma campaign funded by Scottish Government here in Scotland, so that's a really welcome development, but we need to do a lot more. We need to kind of keep raising awareness amongst the public. We also need to do a lot more to raise awareness amongst healthcare professionals because out with the kind of HIV sector, there is very low awareness and quite high stigma amongst healthcare professionals around HIV. So we need to do an awful lot more.
And Grant, I wonder if you know the answer to this. We know that the UK government's announcing opt-out blood tests for HIV, hepatitis B and hepatitis C in more hospitals in England. Do you know what the situation is with that in Scotland?
Yes, so the Scottish Government made a commitment to end new HIV transmission by 2030. That was back on World AIDS Day 2020. We are behind England and Wales. We don't have an HIV elimination action plan yet, but they have announced 3 pilots of opt-out testing, which are going to start sometime in 2024, which we really welcome. There isn't the same funding available to the English model, but it's a welcome step forward.
And Iain, just to go to you finally then, and thank you for talking us through your journey to get to this point. What would you say to somebody who's in that position potentially that you were 12 years ago?
I would say to them to reach out and get the treatment and the support that they need and they deserve. I'm very passionate about peer support. Meeting other people living with HIV is really important to coming to terms with it. It's much better to share an experience with someone who's already been through it, and you don't really get that from the clinical staff that you're working with. They will give you all the clinical support and the treatment and everything that you need, but just being able to sit down with someone who's been through the same experiences as you is a huge weight off your shoulders. That's what I found. It was 6 years before I actually met someone else living with HIV. So that was a long time to be on your own. But when I did eventually meet them, that was just a massive turning point for me. And that's where I came back fighting.
Yeah. Well, thank you for speaking to us today. Thank you very much. That is Iain, who's been living with it for 12 years, and Grant Sudgeon, who's Chief Executive of Waverley Care.